everyone. So today we're going to talk about hair loss. Hair loss can affect just your scalp or your entire body, and it can be temporary or permanent. It can be the result of heredity, hormonal changes, medical conditions, or a normal part of aging. Anyone can lose hair on their head, but it's more common in men. Baldness typically refers to excessive hair loss from your scalp. Hereditary hair loss with age is the most common cause of baldness. Some people prefer to let their hair loss run its course untreated and unhidden. Others may cover it up with hairstyles, makeup, hats, or scarves, and still others choose one of the treatments available to prevent further hair loss or restore growth. Before pursuing hair loss treatment, talk with your doctor about the cause of your hair loss and treatment options. Hair loss can appear in many different ways, depending on what's causing it. It can come on suddenly or gradually and affect just your scalp or your whole body. Signs and symptoms of hair loss may include gradual thinning on top of the head. This is the most common type of hair loss, affecting people as they age. In men, hair often begins to recede at the hairline on the forehead. Women typically have broadening of the part in their hair. An increasingly common hair loss pattern and in older women is the receding hairline. Circular or patchy bald spots. Some people use hair in circular or patchy bald spots on the scalp, beard, or eyebrows. Your skin may become itchy or painful before the hair falls out. Sudden loosening of hair. A physical or emotional shock can cause hair to loosen. Handfuls of hair may come out when combing or washing your hair, or even other gentle tugging. This type of hair loss usually causes overall hair thinning but is temporary. Full body hair loss. Some conditions and medical treatments, such as chemotherapy for cancer, can result in the loss of hair all over your body. The hair usually grows back. Patches of scaling that spread over the scalp. This is a sign of a ringworm. It may be accompanied by broken hair, redness, swelling, and at times oozing. See your doctor if you are distressed by persistent hair loss in your body. For women who are experiencing a receding hairline, talk with your doctor about early treatment to avoid significant permanent baldness. Also talk to your doctor if you notice sudden or patchy hair loss or more than usual hair loss when combing or washing. Sudden hair loss can signal an underlying medical condition that requires treatment. The causes: people typically lose 50 to 100 hairs a day. This usually isn't noticeable because new hair is growing in at the same time. Hair loss occurs when new hair doesn't replace the hair that has fallen out. That's the cause of hair loss. Hair loss typically relates to one or more of the following factors. Heredity. The most common cause of hair loss is hereditary condition that happens with aging. This condition is called androgenic alopecia, male pattern baldness and female pattern baldness. It usually occurs gradually and in predictable patterns: a receding hairline and bald spots in men, and thinning hair along the crown of the scalp in women. Hormonal changes and medical conditions. A variety of conditions can cause permanent or temporary hair loss, including hormonal changes due to pregnancy, childbirth, menopause, and thyroid problems. Medical conditions include alopecia areata, which is an immune system related and causes patchy hair loss, scalp infections such as ringworm, and a hair pulling disorder called trichotillomania. Medications and supplements. Hair loss can be a side effect of certain drugs, such as those used for cancer, arthritis, depression, heart problems, gout, and high blood pressure. Radiation therapy to the head. The hair may not grow back the same as it was before. A very stressful event. Many people experience a general thinning of hair several months after a physical or emotional shock. This type of hair loss is temporary. Hairstyles and treatments. Excessive hairstyling or hairstyles that pull your hair tight, such as pigtails or cornrows, can cause a type of hair loss called traction alopecia. Hot oil hair treatments and permanents also can cause hair to fall out. If scarring occurs, hair loss could be permanent. A number of factors can increase your risk of hair loss, including a family history of balding on your mother's or father's side, age, significant weight loss, certain medical conditions such as diabetes and lupus, stress, and poor nutrition.
Hi. Uh, Ways to prevent hair loss. Um, Most baldness and hair loss is caused by genetics, and it's normal at some point that as you grow older, you lose more hair. Tips that you could follow in order to hopefully prevent hair loss, um, is you could be gentle with your hair. That's the first thing. Um, Excess damage to your hair can lead like for faster hair loss. So using like let's say for example a softer comb or not brushing your hair too hard. Those are the type of things that can hopefully prevent hair loss. Other things that you could do is a lot of medicines and supplements that you take. A side effect of them could lead to like the side effect of the medicine is hair loss. So if you're really afraid of hair loss and let's say for example you have bad genes, um, talking to your doctor before taking the medicine, because it may speed up the hair loss process. Next slide. Excess UV light could damage your hair and lead to hair loss. So just skin in generally, protecting it from the sun could be good. Use your sunscreen. Stop smoking. There could be association between smoking and hair loss. So I'm using the word hair loss too much, but I mean, okay, smoking has an association with baldness or hair loss. So stop smoking. Um, Chemotherapy can lead to hair loss. If you sometimes you can notice that a lot of people with cancer are usually bald. Um, there's the thing called the cooling cap, and that could reduce the risk of losing your hair during chemotherapy. Because chemotherapy is the main thing that's to people with cancer. The cancer doesn't cause the hair loss; the chemotherapy does. Um, so using a cap during chemotherapy can reduce your risk of losing hair during chemotherapy. Next slide. How do they diagnose hair loss? Well, based like it's normal to lose hair um, as you grow older, but there's typical things that a doctor can do to see if you're actually having hair loss. Um, Blood test. It's maybe to uncover medical conditions that have hair loss as a side effect, and to determine the cause of your hair loss. A pull test to determine how strong your hairs are. He just basically pulls on your hair, and depending on the amount of hairs that come off, determines if your hair is weak or not, and if it'll grow back or not. So that's another thing that they can do. Scalp biopsy, and he just takes a sample of your scalp, um, and a few hairs that are plucked with it, and he tests it in the lab and see what's the problem. A light microscope, well, he basically just looks at your hair with a light microscope, and just to uncover possible disorders in the hair. Treatment. Effective treatments for some types of hair loss are available. I think the most common one that people talk about is hair transplant, which we will talk about later. You might be able to reverse hair loss or at least slow it down. With some conditions such as patchy hair loss, hair may regrow without treatment within a year. Treatments for hair loss include medication and surgery, and we will be talking about that. Next slide. If your hair loss is caused by an underlying disease, treatment for that disease will be necessary. So, if it's caused by a condition, let's say ringworms on your scalp, and you're losing hair because of it, treating that ringworm with antifungal medication can be effective, and hair may regrow in that area. Then if it's a medication causing hair loss, your doctor may advise you to stop using that medication. Next slide. Medications are available to treat hereditary baldness, the normal genetic baldness that occurs. And these options include minoxidil, and it comes in liquid form or shampoo forms. To be effective, apply the product to the scalp skin once daily for women and twice daily for men. Basically, it's helpful in the regrowth of hairs and the prevention of future hair loss. So using it can be really helpful in retaining your hair and make sure that your hair is not. I mean, nobody wants to be bald at the end of the day. And possible side effects are scalp irritation and unwanted hair growth. So trying to have a balance depending on your condition is important. Next slide. In most common types of permanent hair loss, only the top of the head is affected. Hair transplant or restoration surgery can make the most of the hair you have left. So when you have it's usually sometimes it's either a receding hairline or there's like a bald spot in the back of the head. What they do is they do a hair transplant and take hair from one part of the head and transplant it into the bald spot. Yeah, that's it kind of. The procedure is not like a medical procedure; it's more cosmetic. But I mean, it can cause some type of discomfort. But I mean, you can it is possible, and lots of people still do it. But hereditary hair loss will progress either way after a few years, let's say, it will still progress. Surgical procedures to treat baldness are not usually covered in insurance, so this is not a true medical surgery. Next slide. And other types of medication, finasteride. This is a prescription drug for men. You take it daily as a pill, and many men take finasterides, experience a slowing of hair loss, and some may show new hair growth. So it's basically just an oral medication that you take to hopefully help your hair. There's other types of oral medication also that can be used to hopefully slow down the hair loss process. There's a new thing that has been approved lately, which is a low-level laser device as treatment for hereditary hair loss for men and women. A few small studies have shown that it improves hair density. More studies are needed to show long-term effects. So it's fairly new, and there's not a lot of research on it yet. Lifestyle and home remedies that you could do No, if you have let's say bad genetics or something like that, you could try several hair care methods. Just take care of your hair. Don't be too rough with it. Um, for example, using hair styling products that add volume, color your hair. Choose a hairstyle that makes widening part less noticeable. Um, yeah, basically anything to take care of the hair is good for hair loss. I personally know a lot of people with bad genetics, and that's like as teenagers they start losing their hair. Um, so just take care of your hair, I guess. It's like it's kind of, let's say, um, like it's gonna happen. It's gonna happen one way or another. So there's not a lot that you can do, but you can do something. That's it, at least. Next time.
Okay,
I think
thanks for
that's
your
pretty much it.
attention. Here's the end of the presentation.